Jamie, long time no speak. Great to have you on the show. Good afternoon.
Yeah, good afternoon, Julie. How are you doing?
Very well indeed. I mean, I think judging my cold, I'm going to be ending up at the doctor's surgery. I hate people who go, "You got a bad cold? Have you gone to the doctor?" No, because doctors can't do anything about bad colds. It's a very strange thing. Now, let's talk about, first of all, the waiting list we've got. Roughly 7.5 million people. How on earth could there be 2 million more people that somehow the ONS, the NHS and everyone else didn't know about?
Yeah, I don't know. I probably treat the ONS number with a bit of caution here, actually, Julia, because what they've done is they've gone out as part of one of their surveys. It's quite a large survey, and they've just asked people if they're waiting for kind of any NHS treatment. And then what you do is they haven't gone out and asked literally everybody in the country. They've gone and asked a sample of the population. And then what they would then do is
Yeah, but it's a big
work out,
sample. It's 100,000
yeah.
people.
Yeah, and it is a big sample, but what you might find is that some people who are on an NHS waiting list maybe have more likely to respond to, say, a survey than people who aren't. And then when you extrapolate that up to the whole population, you kind of get this big number. But it might question the NHS waiting list itself and the figures there, whether or not it's a 2 million gap. Actually, what you're comparing there, Julia, is I think there's 7.6 million appointments for people who are waiting, for 9.7 million for the ONS, which is a 2 million difference. But remember, when you look at the NHS data that comes out every month, some people are actually on more than one list because they're waiting for multiple things. So the NHS data, if you account for that, is closer to 6.3 million people waiting for, say, 7.6 million appointments. So if you compare the ONS number to that 6.3 million, it's nearly 50% higher. So it may be a bit too much, but it does question, is the NHS waiting lists capturing everybody, and where are they?
And it's also how people are counted, isn't it? I mean, just to clarify, you say this is a survey they've carried out, 100,000 adults in England, and they found that 21%, so 1 in 5 people, said they were waiting for an NHS appointment or a test or a medical treatment. And this is where it will come down to, isn't it? Is that, you're on a waiting list because you're in the system. Now, there are a lot of people who just aren't in the system because they've not even gone to see their GP. They haven't even got in they said it's a month's time. They don't know what shifts they're working that week. They can't book that appointment. They just can't get that appointment at a time that they can do. But again, a lot of people can't take the day off to go to a doctor's appointment. They're paid for a daily shift. So, we don't even know about those people. And those people are sadly the ones who do eventually turn up a bit too late to get treated for things like cancer because they haven't gone with early symptoms. And then you've got people that they've gone to the doctor, they've been given a referral to go and see an NHS consultant, but they're waiting for that. But then after that point, they're probably not counted again, are they? Because they're waiting for their radiotherapy or whatever it is, other treatment to start. But they've already counted as being on the list for one thing. So they don't sort of count, even though they're still waiting for the treatment.
Yeah, and the waiting, and I think you quoted some figures about kind of, talking about deaths, because ultimately, what does it mean? If it's 9 million, 7 million, 6 million, even whatever the million number is, far too many. That's the critical thing, Julia. And it all then breaks down into different kind of cohorts of the population. So, for example, if you're waiting for a knee operation, it's not life-threatening, but it kind of is debilitating to your quality of life. And that might mean that people aren't able to work. Yeah. And we're seeing kind of these record numbers of people in the country saying they're not working because they're inactive because of ill health. And then you've got the other side of the coin then, which is kind of cancer patients facing delays. So we do know that getting that treatment and the diagnosis early is the critical thing to surviving cancer. And we're seeing some record cancer rates, Julia. So it's no surprise that other data that's come out recently has shown the satisfaction with the NHS is kind of at an all-time low. That is obviously quite worrying. And many people, Julie, as you said, these are numbers on NHS waiting lists. Some people are bypassing the NHS altogether and going to the private sector.
Yeah, I know people who have borrowed from family. So everyone thinks that, people are going private or they've got the money. But I know people who've borrowed from family members because they haven't got anything, even a couple £100 spare for a consultant appointment, just to sort of kind of jump the queue on that and then go back into the NHS system because they can't get seen. But of course, often it's the same doctors, isn't it, in the private surgery. So, I mean, I've certainly been in a situation going through the NHS with something years back, something told, well, I can't see you for a month on the NHS, but I can see you, in a couple of days' time if you book in my Harley Street practice. And, at the end of the day, it's the same person. It's just the consultants are being paid, the afternoons they're working for themselves, in the morning they're working for the NHS. But I think it'd be better, why don't we just pay them to do all the work for the NHS? Pay them what they're earning privately. It would save more lives. And all the people who aren't getting those operations or losing their lives, I'm sure that would be worth the money, even economically, even if we didn't care about people's lives, which I'm not sure the NHS does sometimes, to have those people treated sooner.
No, I think you've raised a very important point there, Julie, because basically what you've got is people are going to the private sector for medical health, but also the NHS is outsourcing to get the waiting lists down to actually to the private sector as well. And the challenge you've got is because it's the same people, you've only got a finite number of people in the country, that if you actually outsource more people kind of work from the NHS to the private sector, well, these kind of doctors, consultants you talked about, well, they'll put less days into the NHS and more into the private practice, which makes getting the NHS waiting list down even more of a challenge. So ultimately, I think where we are today, Julia, is a combination of a number of different things. We haven't planned ahead for the aging population over the last 10 or 15 years. We obviously shut down most of the NHS for the COVID pandemic. And this isn't going to be fixed overnight. I can guarantee, in 10 years' time, people will be talking about long NHS waiting lists and no party, because this isn't party political, this, Julia. It's the same in Scotland, it's the same in Wales, it's the same in England, and they're all run by 3 different political parties. They need to come together for a long-term solution here, Julia. Otherwise, it's never going to be fixed.
And this is it, because whatever the waiting list, as you say, does it matter whether it's 6, 7 or 9 million? It's still completely... It's so morally unacceptable. And given the amount of money we pay in tax to fund the NHS, and people say it needs to be free. No, it needs to be free at the point of need to people who can't afford it. What most people care about is outcomes. I couldn't give 2 hoots whether the outcome is provided by a private healthcare provider, whether it's provided by the NHS, or provided by some sort of social insurance system, which is what most Western countries have. And it is extraordinary that we are losing some of our best young medics to go work in Canada or Australia or New Zealand or mainland Europe. And they're going to countries, they're saying, we need to shore up the NHS. But they're going to countries which have a completely different system, nothing like the NHS. No country has copied our system of healthcare. And yet, I think it's only in the last few years that people have woken up to the fact, not the idea, the fact, that we don't have a healthcare system that is the envy of the world and that we're massively behind. And even when we make progress on, for instance, outcomes for heart disease or diabetes or cancer, we are still way behind most Western European and even Eastern European countries on your chances of staying alive. And it's that old line, the NHS is great, it's really good at what it does, apart from keeping people alive.
No, and it's got to be fact-based, haven't it, Julia? When you're coming up with policies, you've got to look at the evidence, and the evidence is quite clear that other countries' outcomes have been much better than the UK. Let's go pre-pandemic here in terms of cancer survival. What we need to do is look at what are they doing, what can we learn, and what can we copy to ensure that we get the better outcomes here. And what we currently have clearly doesn't work, Julia. And which party is going to step up and say they're going to reform it? The problem you get is as soon as they mention the word doing things differently with the NHS, that's a kind of seen as a vote loser. But if all parties came together, grown up, let's have a live, proper discussion about this one. Take the politics out of it. Get a solution that works for all parts of the UK, not just little parts of the UK. That's the bit that's going to work. And I think what you said, Julia, let's look, what are they doing in Western Europe? What are they doing in Eastern Europe? What are they doing in Australia? Take the best bits across the world, because you're right, nobody is copying what the UK does. And I think if nobody's looking at what we do, there's got to be a problem there.
Absolutely. And the alternative is not America. No one thinks that's a good idea too, including most Americans. Thank you. As always, great to talk to you. That's Jamie Jenkins, former senior analyst, head of health analysis at the ONS.